Of reaching the hard-hit communities of color was repeated multiple times. This error that Mr. McCarthy mentioned about the cancellation notices being sent in error, while it's being fixed and trying to be addressed, has the damage already been done, especially with people who you're trying to reach and who have not been vaccinated as high of a rate? And people may look at it as, why is this happening to us?
Yeah, so
the damage is not, we've already corrected that, and that's the reason that we addressed it here in our comments today. We're going to continue to try to close the gap. I've been on, I think this is the third week in a row that I've mentioned about the difference between the vaccination rates in the black community, Hispanic community in particular. That's going to be very measurable. So we're going to find out whether we're actually closing the gap on both of those with the work we're doing, and we expect that that's going to happen. The news that we want people to know right now is that there is still appointments available for that community, and then the Equity Council and many people in the ministry, along with Jim Vincent, NAACP, and the Hispanic leaders in the state, are trying to organize that. And I think that's really good news, that the fact that we have community leaders that are really helping us close that gap.
So what happened with that? Why was there a mistake?
That's Tom on that one. He would know that.
Yeah, as we've continued to add functionality, one of the things that was added was the ability to cancel entire appointments tied to pre-registration and a few other things. So we identified the issue through internal quality control checks yesterday, and quickly were able to contact everyone and fix some of the functionality and systems issues. To your point, though, where we're going to be successful is in building and sustaining the trust with our community partners, as the governor has shared multiple times. So we're continuing to work closely with them, ensure that everyone that had an appointment knows that they're good to go for this weekend, and continue to add folks to these clinics this weekend.
Does that dent the trust, an issue like this?
I'm here to earn trust every single day, everything that my team does, so I don't think it will. And we'll continue to ensure that we have those good relationships with the community leaders that are going to help make us all successful here.
We're building trust on the way on that by just doing the activity as quickly as we are and recognizing that there is
a gap, and we're going to close that gap. That's what's going to, when we close that gap, that's what's going to create the trust that we all need in the state. Everybody get vaccinated. Yes?
A lot of businesses are complaining that workers won't come back to work. They want to stay on unemployment. It's widespread. We're about to enter into summer tourism season. I understand there's a bill pending at the State House or being talked about. There'd be some kind of incentive to get workers, because otherwise, between the Biden money and locally, they would actually make more money by staying home. Do you want to address the local business?
Quickly, and I'll push it to Stefan, who's prepared to kind of talk specifically about it. I've been on the record for some time stating that there should be some level of procedure to allow the benefit, the additional benefit on employment, to travel with the individual back to work. So I'm open to that discussion. I don't know whether we need federal buy-in or not, but I've been open to that. So we'll see the particulars. I'll let Stefan maybe talk. I know that Matt Weldon asked us to make a few comments on that if the question was asked. The other point that I would make right now, though, is that most of the people who are looking for workers are the minimum wage workers. So it really does show how important, and not only that our small businesses are in the state, but how important our minimum wage earners are, and so it certainly supports the idea of moving towards that $15 an hour. I'll let Stefan weigh in on what Matt wanted to mention.
Appreciate it, Governor. Very much along the lines that you've already expressed, Governor. Director Matt Weldon at the Department of Labor and Training is exploring a number of options. He's looking at the federal rules as they exist and seeking greater clarification about the $300 additional incremental payment and whether it can follow someone if they are working part-time, that is to say, if they are unemployed part-time. So we're exploring whether with entry into the UI system and simultaneous reentry into the workforce, some of that additional benefit can follow. So that would provide an incentive for people to go back to work. We are conscious that there are also bills that are being introduced along these same lines, and we, Matt Weldon and I, are in dialogue with some of the local business people who, bless them, have put the work in and are trying to figure out some solutions. And we also likely will be reaching out to Washington. Yesterday, I had a call with fellow commerce officials across the country, state-level commerce officials, and this is an issue that is beyond Rhode Island, of course. It's an issue that other states are considering, so we may seek further federal clarification or even legislation in consultation with our congressional delegations. What that all comes down to is Director Weldon's trying to see whether within the rules and even without legislative change on the state level, we can do something significant.
Is that why Rhode Island?
That issue, though, with respect to a private business owner, Dave LeVegue of Bird Awakenings, with the support of dozens of private businesses in the hospitality space, has actually authored innovative legislation that would specifically address that imbalance and also seek to use part of the stimulus funds to bridge that gap with, I think, a pretty innovative 13-week basis, 2- to 3-fold, which would provide bonuses for concurrent input. That bill is being sponsored in the Senate. What is the status of that specific legislation? When do you expect passage? And most importantly, under the McKee administration, are we going to see sort of a new era where you've got stakeholders like Mr. LeVegue and other members of the hospitality or other industries actually engaged in the generation of legislation as opposed to the top-down method which has for so many years been such a failure?
So yes, I've been in contact with David, and I've been on the record for months saying that the additional benefit should some way follow the employee into the the workplace. So I think you just heard an overview. We're certainly open to that. We got to make sure it's legal. We don't want to give any money back to the federal government. We got to make sure we do it properly. So to answer your question, yes, I do believe that there should be a strategy where the benefit follows the the person who's on unemployment into the workplace.
Dr. Alexander Scott, good afternoon. I wanted to drill down a little bit on graduation, because what sounds good in theory may not meet the reality of venues that schools have, capacity. And while it sounds nice, the numbers, there are a lot of places that would not be able to accommodate that many people inside and continue to social distance. So first, is the social distancing 3 feet? What is the social distancing? If you have to hold graduation in a gym, how does that look to you?
We are still requiring the 6 feet social distancing space, but the involvement, as I mentioned, with our state team, with DBR, supported by Department of Education and supported by Department of Health, we would work with an academic institution to make sure that they have what's needed to accomplish. There are creative ways to make it happen, and it's good that we can do it in person this year.
6 feet when the CDC is saying 3 feet in schools. Why aren't you loosening up on that?
The 3 feet component is specific to the structured environment within a classroom, and from CDC's standpoint, it was specifically for the younger school ages. We are applying that a little bit more broadly in Rhode Island because of the strong partnership and our ability to help ensure that it's done effectively. But in other settings, in public venues, in other areas, the 6 feet is important to continue. And what we want with these events is for everyone to follow the venue of assembly approach, particularly in areas where there is no food that's there, and allow for the mask wearing, the distancing, and strongly recommend the testing or being vaccinated where it's supported.
So it goes back to, you want to give people a light at the end of the tunnel. We hear every week, vaccine, vaccine, vaccine. If I'm a parent, I'm thinking, what difference does it make? Because they're going to have me 6 feet apart, and I might not be able to make it into my kid's gym. Do you anticipate, now last year we talked about kids walking across the stage with masks, and that things may get better as the course of time goes on. Would you recommend for some high schools, maybe you want to delay your graduation a couple of weeks into June so the numbers might get better and we may have a different look than what you're talking about now the first week of April?
Those types of conversations have occurred with academic institutions so that there is that option in place. And it's why we really want people to understand these markers that we have set. The May 15th timeframe will mean 2 weeks after 70% of all those eligible to be vaccinated have had at least one dose. That's a milestone. That's really encouraging in terms of saying the amount of the population that is protected and for allowing for more of the flexibility. And we can be back with the governor next week to share some more detail on how we're doing that going forward. And the same for the June 5th marker. So knowing that institutions will have these options, they'll know the determining factor between the May 15th date and then the June 5th date, getting as many people vaccinated as possible, and continuing to support the incremental reopening that we have taken the approach of doing.
For Governor McKee. Governor, you've created vaccine groups, hard-hit communities. Tom went through the whole zip code situation. What about high school and college seniors? I know that the institutions of higher learning have reached out to you. This is once in a lifetime. There are people who've never had their kids graduate, and now they're faced with the reality of kids graduating but parents not able to go. And then you look to the fall coming back. Isn't that a group that you would like to target and get them vaccinated sooner than maybe some others?
Yeah, and I do, and there are other people who are asking for the same, courtesy, and I think that it's important that we do that. So as we get those benchmarks that the doctor was talking about, we're planning in advance that the supply is going to increase and is going to allow us to do into those areas. We were on Newport this week, Sabina and I were on in Newport talking about the Newport's need to be vaccinating restaurant workers. So we're trying to get those numbers together in the state, specifically in terms of the high school students who are in that 16 and older age group. Well, I think we're going to be in a position, especially as you're suggesting that the graduation could get delayed to the second week of June or third week of June, right? We're going to be in a position to kind of hit those target areas. And we're starting to do that work right now. We're identifying office buildings right now. I was talking to a couple different businesses down in Quonset that are in the military area with Electric Boat. They're asking for the same type of courtesy, so as well as Amgen is. So we have these pockets of people that we think are going to be important to vaccinate, and so we're starting to do that planning. But right now, we have a plan. Right now, as Tom said, 86,000 or so doses last week. We still have more of a demand than the supply, so we're just going to stay on the course we're on because that's getting us there. But then being flexible, as you're suggesting, I think is we're already doing it, but it is a good supportive comment.
Alexa, Anita. Yep. Are we still on track to make sure that people over 40 are going to be eligible on Monday?
Yes, we are.
Okay. And then some volunteers with the City of Providence went door to door in the zip code 02907 this past week, talking to people, canvassing to make sure that they get signed up for the vaccine. I did see some hesitancy, but the biggest issue was that they just don't have access. They don't have information that they need. And the system isn't really working for them when they don't have the luxury to work from home. They can't play with glitchy websites. So how are we making sure that we're not leaving those people behind? And is the state going to give the city any more resources for this type of canvassing?
Well, I can start and then Tom can add to that. It's exactly why we have the pre-registration approach so that we can really reach the individuals who may be challenged with, having the time to go in and register. And we know how important the access component is. So we've actually calculated the number of clinics that exist within those zip codes that are hardest hit. And as the governor shared earlier, the majority of individuals do not have to travel beyond 15 minutes to get vaccinated. So our focus, both with this weekend on our equity-focused clinics and for the weeks and months beyond, is to continue to meet people where they are and help ensure that whatever barriers to getting vaccinated, we can overcome together and really reach those targets for the May 15th, June 5th, and beyond.
Governor McKee, the right to control an individual's body has rightfully been the subject of aggressive legislation these past few years. Why then isn't the state of Rhode Island displaying an equal passion in defending the rights of students in the face of mandatory vaccinations by colleges and universities, particularly given the fact that these vaccines have yet to receive full FDA approval and an incredibly low incidence, apparently, of hospitalization or serious cases of COVID amongst this population?
Well, I don't get the connection, but I'll address the issue in terms of the universities. They have already in place vaccination strategies and policies that chickenpox, you got to have vaccination. We support it for the very reason that we can get more people vaccinated. 62,000 students in the state of Rhode Island, live in the state of Rhode Island, attend our college universities. That's going to be a big shot in the arm over the summer if we don't get it to us sooner. And then to the earlier point, high school students, we're not making that mandatory, but we're strongly recommending that all the high school students 16 and older get vaccinated for the very reasons that the reporter just talked about, to get people to be able to go to graduations, to be able to go to their proms and that type of thing. So the colleges, we're very supportive of their policy that I have talked to every college president, and they actually asked us and asked me to get the health department in with them. It's an important point. 62,000 residents of the state of Rhode Island attend college, and they're in an age group that we're very concerned about getting vaccinated. So we applaud the college universities for doing that.
I'm sorry, I want to go back to my question because I was...
Please, Alexa, how to follow up, then we'll go to Anita. Thank you.
Thank you. Sorry, Tom, I wanted to hear what you had to say about hard-hit communities. I think that it's really important for people to hear this.
Yeah, absolutely. So, it's not just about getting shots in arms as quickly as we can. It's getting shots into the right arms, recognizing the communities that have been hardest hit and historically underserved. So a big part of everything that we're doing, concurrent with these large mass vaccination sites is partnering with our local and community partners around how can we increase access, create additional opportunities. So a big part of that is, being out in the communities and doing the canvassing, but continuing to learn from folks that are closest to the community and understand what's going to work best for them. So we're going to continue to build and expand on that. I think we're reaching a critical juncture here over the next few weeks where we are going to have more supply than demand if we're not deliberate and intentional in meeting Rhode Islanders where they are. So something we're building on every week.
Just a follow-up to that as well. Some of the people that I spoke with and that I observed while they were signing up, one of the biggest issues was that they didn't want to fill out all the very personal information when signing up. One of the reasons is they're undocumented and they're fearful of where this information is going. Is there any, future mobile clinic where we can bring shots right to people and we don't have to ask for all of their information, possibly just their name, date of birth, and then end it there?
I think there is. And what's important too is when people show up to the registration sites, we're not asking for your identification at the state-run mass vaccination sites. We're not asking for your insurance card, right? So they shouldn't be concerned in that regard. But I recognize that's a real, fear for many Rhode Islanders here. So we are already piloting some mobile clinics. We're not quite yet at the point now where we have enough supply where we don't require people to pre-register or register ahead of time, but those are things that we're going to test and we're going to see what works here in the near future.
When could that be rolled out? Possibly?
We're actively working on those each week. There are already some mobile clinics in Providence. We're continuing to expand that capability. The good news is, we have a lot of federal resources specifically focused on building confidence for vaccines. So I think there's a great opportunity to continue to build upon these partnerships. But these are days and weeks out. This isn't long-term work.
Dr. Nicole Alexander Scott, Providence announced 3 clinics for the weekend for their hard-hit zip codes. There are still hundreds of unscheduled appointments. Why aren't they being booked faster?
It's all part of what we've just been discussing now. It's the ability to meet people where they are, continue to make the points of access as available as possible, and help understand what barriers are in place to be able to overcome them and ensure that every individual from every zip code is able to get vaccinated. Just continuing to get out into the community, we really applaud and celebrate what Central Falls is doing and what was just mentioned about a zip code in Providence, going door to door, engaging with places of worship, engaging at employer sites, going to either a mobile clinic or places where people shop to meet them where they are and help make it as accessible as possible.
Are you worried that those false cancellations are going to deter more people from actually signing up for an appointment?
No, we're not. We've addressed it. We've called the individuals or are reaching out to them to help ensure that they know. Those type of elements everyone understands is a part of, what happens with technology, and it's really just the key of overcoming it, correcting it, and continuing our engagement with community leaders to strengthen the word about how important this is. So helping everyone really talk about, let's get as many people vaccinated as we can by our May 15th date, and then our June 5th date is a way for us to rally around this together.
Commissioner,
I have one more clarification in regards to the next tier of people that can sign up. Will they have access to mass vaccination sites or just community clinics, or both?
Both, definitely both.
On March 4th,
Brian and John, please.
Can there be dancing at proms?
Yeah, we are supporting proms to follow our current catered events requirements, which allows for specific pod dancing components that I'm sure Secretary Pryor can go into more detail on, if he'd like.
Sorry, what does that mean for the high school students who are like, what can I do at my prom? When you have to tell them what is pod dancing?
Pod dancing.
The basic idea is that pardon.
Demonstrate.
Yeah, that's a very good idea. I think if we orchestrate ourselves up here together, it's basically that you can dance with your table. So if you're orchestrated at a table, you can do that. It's with the people that you are that you came to the dance with, and people sitting at your table with you, and there'll be more guidance online. I will note, while we're talking about catered events, Dr. Alexander Scott referenced that there's some more flexibility that's been granted to them, and since we're discussing the issue, I just want to mention very briefly for those catered event professionals who've been asking. Currently, we have I'm going to make a couple points here. First of all, we currently have a requirement that at events with professional caterers, above 15 attendees, testing is required. We are making the following change given the progress with vaccinations and our stability in our public health conditions: above 50 outdoors. So if you have more than 50 attendees outdoors, testing will be required, not below. And just another quick notation for catered events. Dr. Alexander Scott has defined the important demarcation points of May 15th and June 5th. So there'll be more flexibility for catered events in accordance with those two dates. First of all, the current guidance is 100 permitted indoors and 200 outdoors. Those are both the maximums. By May 15th, that will go to 150 indoors, up from 100. 250 outdoors, up from 200, and that's May 15th. On June 5th, up to 200 indoors and 300 outdoors. And outdoors, speaking of dancing, there'll be more flexibility provided. It will not be required that pod dancing occur starting in June, given the hope and the expectation of better public health conditions.
You have to wear a mask too? Would the students have to wear a mask?
You will, yes.
Hand holding allowed at the prom? Fourth, you were with us, and I asked you about the Providence schools, and you said you were in the 9th inning of the game. We've since learned from the Boston Globe you're actually now apparently in separate rooms during negotiations. How did that start, and do you want to go back and revise, since today's the beginning of the Masters? I'll give you a mulligan. Where would we now be in the course of a game?
So we are in separate rooms because we are in mediation. Right? And that's how mediation works. It's not that we chose to be in separate rooms, but the mediator goes back and forth, and we try to agree upon different things that we each want. So that's where we are. we've taken a few steps back. I think we're having different types of discussions. I think that there are things that we all feel we need to move forward. And some of the things that we have been discussing, almost every single superintendent that has been in the district has been asking for.
John, last question.
Yeah, a question for the doctor. Should people who have been partially vaccinated or fully vaccinated still get tested?
Yeah, it's a great question. Because we are aiming for those goals that we've shared of May 15th and June 5th, where we have more than 70% of the population, either those eligible or all of Rhode Islanders, at least partially vaccinated, we are really continuing to promote the value of getting tested during this time frame until we can reach some of those milestones, particularly with the variant present. Testing is valuable for helping to identify whether or not someone has been exposed to a more contagious variant, even if they themselves are partially vaccinated, because we still have not reached the full herd immunity where the majority of our population is vaccinated. They may expose the virus to someone else who is not vaccinated. So there is value in getting tested. We continue to lead the nation. It's a resource that we want everyone to continue to take advantage of every week during this time frame. As we reach those milestones, May 15th, June 5th, and beyond, we'll be able to provide some updates then about being able to pull back. But for now, we want everyone full steam ahead with testing, treatment, and vaccinations.
Does that also apply to people that have had COVID?
Yes.
How soon after they've had COVID should they get a test?
We use, for regular surveillance testing, the regular testing, we are saying a 90-day period is acceptable for that. But if someone develops symptoms that are consistent with COVID and has been exposed, or even if they haven't, we would recommend testing to evaluate those symptoms.
For some catered events, they require, aside from school events, they're requiring a negative test even if you're fully vaccinated. Can you explain the explanation there? Like why? We
are actually working to develop the opportunity, really encouraging people to get vaccinated, that if you are fully vaccinated, you may not need to fulfill the testing requirement in some of those events. So it's why I went through, if you are attending a wedding that's coming up during those time frames, encourage everyone to get vaccinated in advance. That will be a helpful alternative to the testing requirement that's in place. And we'll be providing some of those details as Secretary Pryor shared.
Governor, for the record, are you supporting
It will change.